Good morning. It's Dr. Jeffreys again on Thy Precious Jewels Health Talk. This morning I'll be talking to us about something that is very embarrassing for a lot of women. Usually we don't even mention it to the doctors because a lot of women believe that it is normal or natural. It is called incontinence. If you find yourself leaking a bit of wee when you sneeze, and when you laugh so hard, that is incontinence. Or if you find out that you can't seem to get to toilet early enough and you end up having an accident, that means you have a bit of a wee drop out or come out of you before you make it to the toilet. That is incontinence. I have just described two different types of incontinence, and both of them are really common in women. Now, hopefully, in the next minute or so, we can talk about what causes incontinence. And in subsequent videos, we'll be talking about how you can manage incontinence and what you can do about it. A lot of women who have problem with incontinence are usually women who have had children. For a woman who has never had a child or who has never given birth, naturally, there is a good support of muscles that hold the lower parts of our pelvis. The pelvis is the lower part of your tummy. So there is a good network of muscles that hold your bladder, your womb, and your back passage and makes everything really tight and nice. Following the strength of the pushing of the baby's head through this particular passage during childbirth, things can get a bit lax or weak. And even for some people, as they get older and the muscles get weaker, you find out that you're not able to hold things up as you used to. This weakness then means that if you put any pressure from within your chest and your tummy, the neck of your bladder is not able to hold your wee in place, and then you have a bit of it escape. Naturally, nobody wants to walk around with wet underwears, but it does happen that you have accidents as a result of this. Now, what should you do if you notice that you're leaking a bit of urine? Apart from worry about it, you can go and talk to your doctor. Your doctor should be able to ask you a few questions to find out why you may be leaking urine. They will ask you how long it's been going on, and they will ask you if you've noticed any other problems about the same time. After which they should examine you. What they will be looking for is to check the strength of down below. Check the muscles and see how strong they are. Check that the bladder is in the right place, the womb is not falling out, and that the back passage is holding tight. Once they've checked this, if they happen to find anything that is of concern, they will advise you how to deal with it. If they happen to not find anything, they will also be advising you what you need to do about it. A lot of women who leak urine can have a solution to it. They can be taught how to manage their symptoms. It is an embarrassing problem. It is one that if you don't take care of, can make you to avoid going out to public places and social functions. But you don't have to put up with it. Can I advise that until you get the courage to go and see your doctor, you can make use of panty liners. These will generally absorb the bit of urine that comes out when you sneeze or cough. and at least you can keep fresh down below. Urine incontinence is something that can be managed. You don't have to put up with it. Go talk to your doctor and let them help you to find the way out. Once again, it's Dr. Jeffreys on behalf of That Precious Jewels UK. Good morning.